Hello, I am Dr. Bapuji, Chairman of Center for Integrated Medicine, Hyderabad. I am qualified allopath, I am qualified naturopath, I am qualified in yoga. I am practicing integrated medicine for the last 45 years. Today, commonest problem, snoring. Snoring is a big menace. If you want to know the types of snoring, whenever you travel in two-tier AC in India, don't sleep. Switch on your recorder in the phone and you go from one end to the other end. You will find types of number of snorings. In between snoring, you will hear Kargil bombing also. Now, snoring occurs because there is narrowing in the throat, particularly when you are asleep and if you are on the back. And during sleep, what happens is physiologically a person is unconscious. When a person is unconscious, tongue falls back into the throat, causing further narrowing. And if he has eaten certain foods which produces mucus, particularly those who have got upper respiratory allergy, they will definitely start snoring. Even children also. Now, as far as adults are concerned, by the time they reach 40, 45, I keep asking the patient, when the spouse comes, suppose if the female patient is there, I ask the husband whether she snores. He very diplomatically says, when she is too tired, sir, sometimes. And when the husband is the patient, when I ask the wife, she says, no, sometimes he snores, or she says he doesn't snore at all. It has become a prestige issue also. In most of the developed countries, snoring is the criteria to take divorce. The husband can file a case saying that I am fed up with my wife snoring, I am not able to concentrate on my work, it has caused a lot of stress, and my lord, I would like to take divorce. That is the criteria to take divorce. Similarly, wife also can file if husband snores like hell. Now, what is the cause of snoring? I told you it is the narrowing of the throat. When you breathe in and breathe out, you will make noise. That noise, particularly during sleep, is snoring. And to get rid of snoring, there are a few things which I am going to give you tips. Now, allopathic people are advising surgeries, particularly ENT surgeons. Remember, there is no surgery, there is no permanent narrowing in the throat. This is all, humbug only to loot money from patients. Results are, I have not seen so far, at least 3 cases I have seen who have undergone surgery, snoring has not gone. What they do is they remove the swelling of, we call it as turbinate swelling in the nose, where lateral wall there are some ridges, and then whenever nose is congested, nose is blocked, that also swells. They remove those turbinates and charge for the surgery. That's what is happening, that's all. There is no surgery, please remember. Now, snoring can be got rid of by following certain diet restrictions for 2 months and follow breathing exercises and jalaneti. Jalaneti is a yogic kriya where we take hypertonic salt solution and put it in one nostril. It passes through automatically on its own. There is a procedure. We will show you the procedure also. There is no problem at all. So diet restriction reduces the mucus formation, phlegm formation in the throat and nose, and breathing exercises clears the sinuses, because when the air passes through nasal passage, there is a vacuum created in the sinuses. You must have seen in a tube, if there are attached pockets or chambers, if air passes through the tube fast, there is a vacuum created and those chambers will get emptied. Another example I'll give you, common which you see on the roads, when the bus passes fast, in autumn when the leaves are there, leaves and papers run behind the bus, because bus is a large size vehicle. When it passes, it disrupts the air, creates a vacuum there. Same principle here. Breathing exercises help in desensitizing the respiratory tract, upper respiratory and as well as lower respiratory, and it creates a vacuum so maxillary sinuses can be drained. So the first step is to get rid of snoring. You have to go on certain diet restrictions. First diet restriction is you should stop animal source of protein, because most of these problems are allergic problems, and protein is supposed to trigger any allergic reaction, particularly procaine, which we add to the penicillin, that gives fatal anaphylactic reaction. Similarly, pollen, which is protein in, most of the allergens are proteinous in nature. So, and there are a few more other than protein which I will describe in the dietary restriction. So, first dietary restriction is stop animal source of protein. What are the animal sources of protein in our diet? For vegetarians, it is the milk, curd, buttermilk, butter, cheese, paneer, cottage cheese, they say paneer, and cream. These are things which have to be avoided. Similarly, egg also has to be avoided. Similarly, you have to avoid chicken, meat, fish, beef, pork, and prawns and crabs also. Any animal source of protein you will withhold for 2 months. 2 months. Now, should we take coffee or tea, sir? People do ask. You can take black coffee with sugar. You can have green tea with sugar. You can also eat ghee. Ghee is when you heat butter, the casein, white portion of the milk, which is the culprit in triggering the allergic reaction, gets charred at the bottom, and the oil which is separated is ghee. Ghee can be used, there is no problem. So first source is to prevent allergic reaction is animal source of protein, which I have narrated. Second group of foods is foods which contain colors, synthetic food additives and preservatives. What are the items we have? We have soft drinks, particularly aerated, the color in it, okay, then the flavor which they add, and some of the cool drinks I don't want to name here. The formula is secret, I believe. What it contains we don't know. And one cool drink contains coal tar product also. That gives a different flavor, and it's, I believe, it's a secret, and for decades they have not revealed, and it is for public use. So cool drinks, sauce, jam, ketchup, bottled and tinned foods which contain preservatives so that it doesn't get spoiled. If a fungus grows there, he will go out of international market and local market also. So all tinned and packed foods and dairy products, cookies, biscuits, pastries, cakes, and any noodle which is packed, contains preservative. Usually they use sodium bromide, and these are the things to be avoided. And third, alcohol also to be avoided, because alcohol causes flushing and phlegm formation will be more, and next day they have weekend headache. People do have weekend headache on Monday. It's because of flushing of the blood to head and neck area, and phlegm formation will be more. Then the third group is sour fruits and vegetables in raw form. For example, grapes. Grapes I am discouraging because in India the control on pesticide usage is absolutely haywire, and it contains lot of pesticide. Right from flowering stage till they remove the bunch, it is full of pesticide. Any amount of washing it will not go, particularly the skin of the grape. Grapes should be avoided lifelong, potential carcinogen. Then citrus fruits like oranges, sweet lime, guava, pineapple, custard apple, and gooseberry, which contains a lot of C, gooseberry. Any such fruit which is sour should not be taken and not difficult to follow. Then what is left for eating, doctor? You can eat all grains, there is no problem. All pulses, no problem. Then you can eat all vegetables including potato. You can eat normal salt, normal chilies, garam masala we say in India, and all spices you can have. Fried things also you can have. You can have idli, dosa, vada, puri, uttappa, chole also. And not bhatura. Bhatura contains curd in the dough they mix. And non-citrus fruits like banana, apple, papaya, sapota, pears, and muskmelon you can have, and you can have dates, you can have figs. Sufficient. So start following this diet. I am not saying you have to follow lifelong. Just follow for 2 months. After that you can identify which one is the culprit. 85% Indians have upper respiratory tract allergy and sinusitis. 99% Westerners, Europeans, Australians, they have, because the amount of beef and pork they consume, the amount of eggs they consume, the amount of dairy products they consume, it's a very common problem. It causes bad breath, it causes snoring, it causes nasal congestion, and if snoring is severe, nowadays they are putting CPAP. There is a machine which blows air into the lung and it allows it to come out on its own. DPAP, it blows air, it sucks air. It's like external ventilator minus oxygen support. And follow breathing exercises, Jalneti, which will put it in this video itself. That will be able to help you. Thank you.